hello.
Just grab their hand.
I had somebody do that when I was giving them
Give her straight so they come around.
iron shot, and those stain, and it's like,
Ouch. Okay, so number 7, same thing but just post-op. So what do you think happens after post-op when they come from PACU to post-op?
you need
Vital
to go more.
signs.
You teach them about pain.
Mm-hmm. The first thing that happens is the PACU nurse gives the post-op person another report, post-op nurse, another report, just give her the whole story. It's just kind of like a chain of like what happened, chain of story. So yeah, they kind of tell them what happened. You orient the patient to the floor. Like Chelsea was saying, you gotta tell them again, just kind of the teaching, like what precautions they're under, how the surgery went, just kind of what they've got done, just reorient them, because they could be awake, but they kind of be confused. So that's huge. Yeah, because a lot of times they're confused, and then a lot of times post-op, because of the anesthesia, they could be really nauseated, because that's like the number one thing you see. So if they don't already have Zofran in them and they would like some, you can give some of that. But that's the main reason why we hold like food after surgery, just because they're gonna throw it right back up. So you kind of start on like ice chips, and then like clear liquids, and then just go as they tolerate it, just move up from there.
Does it have to be prescribed, or is that something that we can kind of give freely whenever they need it?
Zofran?
Yeah.
It could be on the doctor's orders. It might be because it's post-op, and that's a usual thing after anesthesia. So it could be like a standing order, like Zofran, 500 milligrams PRN, so as needed.
Yeah, as needed.
But if it's not, then obviously you call the doctor.
Okay.
What was the abbreviation for as needed?
PRN.
Yeah.
Love that. I don't want to write as needed all the time. Okay. So yeah, teach them. Teaching is huge. Also, you kind of want to get them up, which they hate. Get them up, go into the bathroom, get that system working again. So teach them about ambulation and the importance of it again. Let's see.
So they don't feel that pain. And does that, when like in class, was it in class that she was talking about the pain? How like the CO2 rises to the chest?
yeah.
Is it mainly just that, or
It
is it
happens
other
like
things
later
as well?
when you go home. Like I've had one, like when I've had a surgery and they did that, like it happened like days later.
Yeah, it's not always immediate.
Because
So it
like they
takes
fill up
time.
your abdominal fluid and then like later I got the
But that's the main
shoulder
cause
pain.
of the pain, is the buildup of the CO2.
That they put in your
Okay, so vital signs, super important. Why do you think we do vital signs so frequently after surgery?
You want to see where they're at.
Yeah, and just see how their body is coming back.
baseline.
Yeah, what they deviated from, just kind of get them back to their normal. So you do 15 minutes, or sorry, I'll write this out. Q 15 minutes times 4, Q 30 minutes times 4, and then is it Q 60?
Yeah.
Q 60 times 4, and then just Q 4 hours. So that's the sequence you do it in, no matter if it's normal or not, just keep doing it in that. Just, go ahead.
When you mean by 4, you do it every 15 minutes.
Times 4.
Times 4.
So this would be like, this would be 1 hour.
So you do it 4 within an hour, and then another one would be 4
Yeah,
within 2
or
hours.
just 4 times. So get it 15 minutes 4 times. So it'd be 1 hour, this would be 2 hours, this would be 4 hours, and this would be 1
60.
or 4 hours. Sorry. Does that make sense?
Oh, gotcha. Okay.
So you do 15 minutes
Yeah.
4 times.
Okay.
Yeah, good question though. That's a good question. So if they're normal or not, you just kind of keep making sure. Just because in case they do drop or something, a reaction happens, you know faster than if you're doing it every 4 hours. That's usually scheduled. Just so you can assess them better, and because the vital signs are the main functions of our body. So super important. Okay. What are some things we want to teach them about how to deal with them post-op? What kind of things, like ambulating and stuff, things like that? What do we need to teach them?
And it kind of depends why they were in the. Instead of spirometer. That's another one.
That one's huge with like
turn,
almost
cough,
every
debrief.
patient, right?
Yeah.
Yeah, instead of spirometer, you want to teach them to ambulate. If they have any assistive devices, like, does anyone know what an abdominal binder is? It's like this like huge belt that goes like from here to here. You kind of stick it on you tight. So if they have like an incision on their abdomen and they cough, it doesn't like dehiss. So, or like they get up from their, like do like a sit up.
What is it called?
Abdominal binder.
Oh.
Did you guys play with one in lab today?
No.
No. So yeah, abdominal binder.
So it's like a. What
Is
do they
it-
call it? The pillow that you put over your stomach.
You can use a pillow too, and like if they're gonna cough.
Splinting.
Splinting, yep. Also, if they have like a back brace they need to wear, you can do that. Or even like CPM. That's like as if anyone's gotten any surgery, probably not.
I have.
You have?
I broke my hip. I have
Oh, it's like that thing that like you lay them on the bed and their knee constantly goes like this to keep the joint.
And we took out a utility pole and my ball joint got pushed up into my pelvis.
Ow.
Broke it in 2 places.
Fun.
Happy senior year.
Senior year, did you play
graduate in
sports?
crutches?
I graduated in a wheelchair.
Oh, in a wheelchair. I graduated on crutches.
Did you play sports?
I used to play soccer.
Oh, that's like if you're like mid-season.
I didn't play for the school.
Oh,
It's like near the end of my senior year.
yeah. Shoot. But yeah, just teach them anything they're gonna use, any assistive devices. If you need crutches, kind of show them how to use those. Wheelchair. Just kind of orient them again. Septum spirometer is huge. Teach them turn, cough, deep breathe, things like that. So, leg exercises. Also teach them about their dressing, like what to look for if it gets drainage comes through, how often you're gonna change it. Remember, the doctor always changes the first dressing. That's important too.